Namaskar. I am Dr. Murali Manohar. Welcome to Ayurveda Samhita. In this program, you are going to learn about an important topic and some powerful ancient Ayurvedic secrets. These can change your entire life forever.
Arthritis. The rheumatic diseases rheumatic fever, rheumatism, and rheumatoid arthritis are acute and chronic conditions as the body is filled with rheum, a form of ama, residual impurities deposited in the cells as a result of improper digestion. This rheumatic disease provides a good example of an autoimmune condition, a disordered self-protective mechanism, characterized by inflammation, soreness and stiffness of muscles, and pain in joints and associated structures. This can often be successfully managed by an Ayurvedic approach. Rheumatoid arthritis is called Amavata in Sanskrit, which means that it occurs when Vata, one of the three constituents that govern physicochemical and physiological activities of the body, circulates ama in the body, while improper diet is the most important cause. Other causes include exhaustion, frequent sex, intense worry, and emotional disturbances. Improper fat metabolism in the digestive system creates a variety of ama, which shows a special affinity for the bones and joints. Since the membrane lining the colon is intimately connected with the nutrition of cartilage and bone, this ama swiftly reaches its preferred location and deposits itself. The immune system sweeps into attack, and the disease is created. If allowed to continue unchecked, the inflammation becomes chronic and destroys the joint, which causes nearby muscles to shrink. All this happens because of undigested material in the colon. The pain and stiffness in the muscles and joints increase gradually over weeks or months, accompanied by unusual tiredness and a general feeling of unease. In 1 out of every 10 victims, however, it develops all of a sudden, followed by fever, severe uneasiness, body ache, indigestion, and tastelessness. Like other autoimmune diseases, chronic rheumatoid arthritis displays two separate, alternating phases: exacerbation and remission. During the exacerbation phase, there is acute inflammation of the joints. During remission, the symptoms disappear because the acute accumulation of the doshas, causative forces in the disease process, in the joints is scattered. Because there is much ama in arthritic joints, any dosha accumulation in the digestive tract always tends to return to the joints and exacerbate the condition again. Health can return to the joint only if ama is treated. Effective management of arthritis involves immediate elimination of doshas during exacerbation, and gradual elimination of deep ama during remission. Guidelines and Ayurvedic remedies. The basic philosophy of therapy for rheumatoid arthritis is as follows. Food during an exacerbation should be light, little and liquid. Weak ginger tea taken with lemon and honey, if necessary, is best when your tongue is thickly coated. Then take rice, gruel, and green gram soup. Continue with for at least a week before going back to your normal diet. You should try to avoid animal fats, fried foods, dairy products, refrigerated food, white sugar, alcohol, chilies, potatoes, tomatoes, peppers, and tobacco. Reduce the use of salt, of the oils. Castor oil alone can reduce the inflammation and scrape out the ama. A film of castor oil should be applied on the affected joint, and then dry heat should be applied. Wet heat aggravates obstruction and congestion. Take a mixture of equal parts of sand and powdered rock salt, heat it in a pan and pour the heated powder into a cotton or linen bag, and apply it to the joint. It helps dry out congestion in the joint. Sunbath is also good for arthritic joints. The intake of bitter and pungent substances controls vata and relieves ama, especially during exacerbation. They stimulate digestion indirectly and help reduce inflammation. Bitterness is especially needed when there is severe and generalized body ache, loss of appetite, loss of taste, indigestion, and fever. Some commonly available substances which are wholly or partly bitter include gudoki, Tinospora cordifolia, neem bark, etc. Bitter Ayurvedic compounds like Mayasudarshan churna, etc. actively help eliminate the allergic state from the system if used regularly for at least 6 weeks. Triphala Gunguliu, a compound preparation, is often useful in such conditions, since trifalas, 3 myrobalans, in it purify the system and long pepper improves digestion while Gunguliu, a plant exudate, controls the inflammation in the body. However, Simhanada Gunguliu is the best medicine during exacerbation. It contains castor oil as one of the important ingredients. If the digestive tract is coated with ama, it is wise to take 2 to 4 tablespoonfuls of castor oil plus a cup of strong tea made of dry ginger to thoroughly flush the colon and purify the joints. There is one simple recipe for rheumatic complaints. Crush 2 to 3 cloves of garlic, add it to a glass of diluted milk, then reduce to a quarter and drink it just before bedtime. Eating a balanced anti-allergic diet is appropriate when the exacerbation diminishes. Good Ayurvedic oils for rheumatic conditions are Dhanwantara Tailam, Ksharabala Tailam, Sahacharati Tailam and Vishagarba Tailam. All these oils are medicated to purify and lubricate the joints. Intermittent medicated enemas, especially when bowel habits change and the lower tract is full of gas, are important to keep the lining of the colon healthy and clear of ama. Gunguliu is useful during remission to remove old, adherent ama from the dhatus, basic body structures which perform some specific actions. The best varieties here are Yogarija Gunguliu and Mahayagaraja Gunguliu. Both contain more than 24 pungent herbs for improving digestion, but Mahayagaraja Gunguliu also has minerals in it for a greater rejuvenating effect. Simple yoga postures and breathing exercises encourage elimination of ama. As your health improves, supplement the yoga with energetic exercise. A regular exercise program is especially important for overweight patients since heavy limbs put extra strain on muscles and joints. Maya Rosnadi Kata in the dose of 20 milliliters with equal quantity of lukewarm water twice a day is beneficial. Brihadvata Chintamani Ras in the dose of 125 mg to 250 mg twice or thrice daily is the drug of choice. Anti-inflammatory herbs. The Ayurvedic material medica lists a wide range of anti-inflammatory drugs that can reduce the pain and swelling in case of different arthritic conditions. The treatises like Sharaka Samhita, Sushruta Samhita, Bhava Prakasa etc. describe these drugs. A good number of scientific inquiries have been made for evaluating the anti-inflammatory activity of these medicinal plants by several researchers. Ginger. The Department of Environmental Medicine, Odense University, Denmark 1989, conducted clinical studies on patients suffering from arthritis by giving dry ginger powder and fresh ginger. Better movement of joints was observed in these studies. Recent studies have shown that ginger is capable of preventing the synthesis of prostaglandins which are responsible for inflammation. These observations were published in the Chemical and Pharmaceutical Bulletin, 1992. For stomach ache, just take the infusion of dry ginger with a tablespoonful of castor oil. Dry ginger with sarjak shara and a pinch of ing, asafoetida, is also a popular remedy. In chronic rheumatism, take the infusion of dry ginger just before going to bed, and cover your body with blankets to produce copious perspiration. Externally for the relief of arthritic pain, you can apply ginger as paint or plaster made by rubbing the tuber with little water. Licorice root. Gujral and his associates 1956 have claimed that Yashtamatu or licorice is the best herb for treating inflammatory diseases. After this study, Malhotra and Ahuja investigated and came up with the fact that the efficacy of licorice is due to glyceridic acid and its steroid nature. Licorice is popular today as it was 3,000 years ago and is freely available even at the grocery shops. Chew a piece of licorice or try its extract, which is even more effective. Its decoction taken after meals aids digestion and acts as an antidote for peptic ulcers, gastritis and gouty arthritis. Asafoetida. If 2 grams of hing or asafoetida is dissolved in 1 tablespoonful of coconut oil and applied as an analgesic balm, it gives immediate relief from inflammatory conditions. In addition, the paste of hing mixed with lime juice can be applied over wasp, bee and scorpion stings. Turmeric. A volatile oil isolated from the fresh rhizomes of turmeric was found to possess marked anti-inflammatory activity, so, take a pinch of turmeric a day to keep degenerating diseases away. Externally you can even apply a poultice prepared by mixing turmeric powder with a little slaked lime and the white of an egg and give a mild fermentation for relief of pain caused by sprains, myalgia, dislocation of joints, boils, cuts, wounds etc. Garlic. Recent studies established the anti-arthritic nature of garlic. Daily doses can strengthen your immune system, rid you of pain, and even clear up your arthritic conditions. Vitex Negundo. Nirgundi. Leaves of Nirgundi or Vitex Negundo are recommended mainly in inflammatory, glandular and rheumatic swellings by Ayurvedic treatises. Marking nut. Mhalataka. Application of marking nut to ease joint pains is still prevalent in suburban areas of India. Recently, in some of the experimental studies, its use in the treatment of rheumatoid arthritis has shown that the patient's ESR had been reduced and xylose absorption had also improved. However, as this drug is a potent irritant, it should be handled very carefully. Nictans arbitristis. Parijata. The alcoholic extract of the leaves of Parijata has a significant tranquilizing as well as a dose-dependent antipyretic effect and histamine antagonistic and purgative activities. In a clinical study, the leafy decoction, 30 ml per day of this drug was administered in 24 cases of sciatica and statistically significant results were observed. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination and Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will meet with another interesting and important topic. Satam Jiva, Sarado Vardhamanaha. Satam Hemantan, Satam Vasantan. Live over 100 years old with excellent health and complete happiness. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.